Hey everyone, so I'm here today to talk a little bit about pain and how kind of thoughts about pain have evolved over time and how we may actually be our worst enemies when it comes to being injured and eventually ending up with a persistent pain. And I'm not saying pain is all of our faults. I'm not saying that it doesn't have to do with the injury, but sometimes we can have these negative types of behavior that then cause us to go into this loop. And this loop that isn't all that wanted. And sometimes as a physical therapist, my job is to help people and empower them to say, look, pain isn't necessarily always a bad thing. It's a warning symbol. You can work through pain from a certain number standpoint and certain degree standpoint, and it doesn't necessarily mean that you can never do something again that you love. And that's what bothers me most. Certain healthcare practitioners out there definitely do not aid people in getting better, and they give them all these terms and they use these words such as never or cannot or forever that really make people feel less empowered to get better. They think that these things are going to go on for ages, and that's the most unfortunate part. So how can we help, and how can you help better empower yourself when you're in pain so that pain doesn't last? And one of the big things I see people do the most is stray away from their pain. If I have back pain on the right side, or say I have like a hamstring strain, I sometimes see people doing this all the time. Or I see people who eventually fall into this disuse pattern who haven't done a certain movement in, say, 20 years because at one point in time they were told, if you do that, it's going to make something worse. And that's not always the case. You can't always believe in Dr. Google, and Dr. Google is our best frenemy. There's so many things that we can learn. Same thing with YouTube. So many things that we can learn, but there's also so much misinformation out there. And I really hope that by looking at this, you can empower yourself a little bit more. So pain is multimodal, and what I mean by that is it doesn't only have to do with, our physical ailment that's going on, but the psychosocial component of life too. How are you doing? How are you feeling? What are your surroundings? There's so many things that go into it, and pain is studied daily now. It's not necessarily a one-way street like some people used to think. We used to get a cut, and because of that cut, that's where it hurt. Think about this a little bit. You have a guy, who's a carpenter, hits their hand with a hammer, and to them, it's just something that happens on a daily basis. Meanwhile, I can tell you, I've done this before where I go and I'm nailing something in a wall, and all of a sudden I hit my hand with a hammer. And you probably see me doing one of these, holding my thumb, shaking it, shaking my hand, afraid to look at it because I'm afraid it's gushing blood. Well, you know what? That's the difference. Not everybody's pain sensations are the same, and sometimes it can be negatively impacted by something like this. So unfortunately, I had different plans and I had this on my whiteboard, but then I realized that my whiteboard is glass and it has a really bad glare. So I'm gonna try to bring this a little bit closer. So here we are, okay, and if I look at the computer screen a little bit, I'm sorry, but we have an injury, okay? Whether you have a knee sprain, a knee strain, a muscle strain, or you kind of sprained your ankle or something of that sort, and all you think about is, oh my goodness, I cannot do what I love. Okay, so you have an injury, and then we all have this pain experience that occurs. We feel the pain, and we all have different ways of thinking about it. Oh, you know what, it's gonna go away, and then it never goes away, and then we start worrying about it, or we have pain, it goes away, it comes back. Everybody's pain is different. Remember that. Not everybody is the same. Your neighbor may have an injury that is the same exact one you had, say, a day before you, and they're already back doing what they love, but yours is different. Well, maybe we can help figure out why. So here's your pain experience. Now, most people who are successful in rehabilitating, we look at it this way. You have a pain experience, somehow, some way, you're not too fearful about that pain. You start doing things again, you start bending, you start lifting, you start moving, and then you confront it, okay? You accept it, and you don't have fear in regards to the condition that you have or the pain that you have. And with that, you can go on to recovery. And that doesn't mean that you're necessarily always out of pain, but you go back into doing the things you love, and eventually you'll probably have less pain that maybe comes and goes, and you know how to battle it. Now, when we're talking about people who end up with some chronic pain and some long-standing pain, sometimes this is what happens. And sometimes it's due to misinformation, it's due to negative attitudes, it's due to, threatening information that we've learned, whether it be online or whether we've learned through our healthcare practitioners. You know what? I've been there before. I've said something that I've said, ooh, you know what? I should have probably said that a different way. We're looking to empower people and definitely make experiences in regards to pain a little bit more lighthearted. So here we go. So we have a pain experience, and then we go into this pain catastrophizing status. We can't stop thinking about it. It doesn't go away. Why doesn't it go away? I was told that I have a herniated disc. I was told that I'm never going to be able to deadlift again. I was told that I'm never going to be able to lift weights again. They told me I have arthritis. Oh my goodness, that means that I'm going to have issues for the rest of my life. Well, not necessarily, okay? Just because you heard some of that information doesn't necessarily mean that. Now, if you continue to do that, then we get into this pain-related fear category. We're fearful because we've been told something is relating to our pain and that's why we're having it and we cannot do what we want to do. Well, that's just a bummer because, guys, if we look over here and there's no fear and confrontation, that helps that recovery a little bit more. So if we go into this pain-related fear category, what we then start to do is avoiding things. We're hyper-vigilant. We say, I cannot sit on my right butt because it hurts. I cannot bend to the right because it hurts. I cannot drive a certain way or sleep away because it hurts. But what if all we needed to do was confront it a little bit? We need to move into it every once in a while. We need to make sure that we're actually utilizing it. And we can be fearful about it. Sometimes, yes, especially when it's more significant. But we can't always sit here and say, my pain, I can't do this. What if we thought about it a little bit differently, okay? So if we're avoiding and becoming hypervigilant, we then go into this status of disuse, depression, and disability. And those are terms that nobody really likes. But we've all seen our family member, somebody have an injury who used to be the highlight of the party, and then all of a sudden one day you see them and they've been injured. They come in and they are just not the same person. And they're upset and frustrated because they're in pain and they can no longer do what they want to do. But the thing is this cycle has occurred, or it might have occurred. And if we continuously drive this cycle, as you can see, it's a continuous loop. I want you guys to think about this a little bit differently. I want everybody to think about pain a little bit differently. And sometimes when people come into the office and I explain to them, hey, I need you to actually move into your pain. I need you to confront it a little bit more. I typically see some better outcomes. And if I tell you that, if I took an MRI of say 100 people, so many of them, say 75 out of the 100 would probably show some type of arthritis, herniated disc, bulging disc on an MRI. How do you feel about that? Certain things in our bodies are like having gray hair, and it doesn't necessarily mean that they're always a cause of pain. So let's think about this a little bit. If you're in chronic pain, start changing up the narrative a little bit. And I know it's hard, but maybe search for some help. Somebody who has a little bit of a different outlook, or somebody who has a little bit of a different approach to it. Pain shouldn't always persist. It's not normal. It may be common, but it's not normal. So if you guys have questions about this or need help kind of figuring out the cycle, feel free to reach out. As always, we love hearing from you. So if you have questions, go ahead and ask.